Dr. Tiffany Randolph with Cone Health Heart and Vascular at Drawbridge Parkway is with us, and we're talking about high blood pressure, hypertension. So we talked about how at 18 you should start checking your blood pressure at least once a year, but how often should adults check their blood pressure depending on their age?
So, interestingly, the risk of hypertension goes up significantly with age. So, by the time you're in your 60s, half of the population has high blood pressure. By the time you're in your 70s, it's actually three-quarters of the population. So, this means that as we age, by the time you're 40, really have to be checking that blood pressure at least once a year. And interestingly, hypertension affects different races significantly. So, people of African descent are much more likely to develop hypertension and to get it at a younger age. So even in your teens, 20s, 30s. And so for this population, it's especially important to check because not only are they more likely to have high blood pressure, but they're also more likely to have what we call resistant hypertension, meaning it takes 3 medicines or more to get the blood pressure under control.
Right. We want to avoid those medicines if we can. So one more time, let's go over what is considered a normal blood pressure reading.
Normal is less than 120/80.
Okay, and what's considered high?
So this is such a moving target. So if you have known cardiovascular disease, if you've ever had a heart attack, a stroke, if you've got kidney disease, diabetes, or if your risk of those things happening is high, meaning 10% or more in the next 10 years, or if you're African American, your blood pressure should be less than 130/80. If you do not have any of those risk factors and the only thing you have is high blood pressure and your overall risk is low, then less than 140/90 is considered an acceptable target to aim for.
Okay, but once 140 hits, I mean, that's it for everybody. You need to be talking to someone. So I guess that's my next kind of thing. When is it time to call your healthcare provider versus when is it time to call 911?
Good question. So symptoms are always key. If you are having high blood pressure readings, meaning, 160s, 170s, 180s, and you're having chest pain, shortness of breath, if you're having severe headaches, or if you have any stroke type symptoms, for instance, if you have sudden onset of slurred speech or blurry vision, if you're having weakness, numbness, tingling on one side of your body, those are all reasons to call 911 emergently and not drive yourself to the emergency department. However, if you see an alarming blood pressure reading, like say 180/120, it absolutely needs to be addressed urgently. Hopefully, you can get in to see your primary care provider. If not that, then you can consider urgent care. But if you're not having symptoms, you don't necessarily have to go to the emergency department right away.
Okay, but you do need to make sure you get in with your doctor sometime soon.
Absolutely.
Okay, now if someone is at high risk or has been diagnosed with high blood pressure, what kind of steps should they be taking to lower their risk and maintain a good, healthy blood pressure?
This is the $1 million question, right? So I tell patients all the time, my goal, and I'm sure your goal too, is to control your blood pressure with as few medicines as possible. And so that means that if we're not going to take medicines, we have to put the work in from a lifestyle standpoint. So the first thing is thinking about our diet, limiting caffeine intake. I would never take anyone's 1 cup of coffee away, but try to keep it under one caffeinated drink per day. The other things that we watch for are sodium. So we recommend following something called the DASH diet, which means keeping your sodium under 2,300 milligrams per day, which is actually really hard to do, especially if you eat out. So cooking at home as much as possible is key. Trying to use fresh and frozen vegetables. Anything that can sit on the shelf for a year and not go bad probably has too much salt in it, and they're using that as a preservative. Other things to watch out for are alcohol. So really for women, maintaining less than one drink or less per day, less than 7 over the course of a week. And for men, less than 2 drinks a day, no more than 14 over the course of the week. All of these things can contribute. Some things we don't think about too might be sleep apnea. So if you have sleep apnea and that's untreated, it also makes it really hard to control your blood pressure. And last but not least, exercise, right? We have to move our bodies. If you can move your body 150 minutes per week of moderate to vigorous exercise, that will give you over time just as much improvement in your blood pressure as any one medication can.
All right, we got about 1 minute left. Who should someone contact if they're concerned about their blood pressure or if they think they might be in that high risk category?
So absolutely start with your primary care provider. We actually, this in the last 2 years, developed what we call the Advanced Hypertension Clinic at Cone. And what we do is we serve as a resource for people who are at really high risk and are struggling to get their blood pressures under control. So, if you do have resistant hypertension, if you are on 3 meds and still can't get your blood pressure controlled, if you're really young and don't have other risk factors and have developed hypertension, it's worthwhile to make sure there's no other underlying things that could be causing your blood pressure to be high. So start with your primary care provider, and if that's not controlling it, we are happy to see you at the Advanced Hypertension Clinic as well.